Hello, my name is Chelsea Whittington, and I am honored to be here once again on behalf of Edgewater Health. As you well know, May is Mental Health Awareness Month, and each week we have been talking to different employees and team members here at Edgewater Health. I am so pleased to welcome to the set today nurse practitioner April Donald. We go way back. It's been a while, but she has still been in the business of saving lives and giving great care. Hi, April, how are you?
Hi, I'm good. Thank you for having me today.
Thank you for being here. And as a nurse practitioner, I know you are in a special area of expertise, and I didn't want to butcher up the terms, so I'm going to ask you to explain specifically what your area of specialty is as a nurse practitioner.
Okay, as a nurse practitioner, I work in family medicine or primary care. Here at Edgewater, I work in our primary care department, and we work and focus on different diseases, mostly chronic care management.
Chronic care management. Now, elaborate a little bit on that. What does chronic care management mean?
So those would be things that people are most familiar with, would be things like hypertension, diabetes, hypothyroidism, chronic pain management, those types of things.
Okay, and just the terms that you just used struck a chord with me in thinking about things that run rampant in the Black community. We talk about diabetes and chronic pain management and things of that nature. And with this being Mental Health Awareness Month, what we have been doing is making the connection between the various professionals here at Edgewater and how their paths still cross with mental health. So I'm going to take a stab here, April, and I would say diabetes can be mentally stressful. I would think, as far as trying to keep your numbers down, regulated, out of the hospital without your family members getting on you saying, get those numbers down. How does your profession and what you focus on parlay over into the world of mental health and mental wellness?
I think that's a really big question. It's a really big statement. And I think that starts before the patient gets to us without them really realizing it. They might start experiencing symptoms. They might feel fatigued. They might start having feelings of heaviness. They might feel jittery, and all of those would begin to be signs or symptoms of the disease process of diabetes. And they may begin to have some underlying feelings of anxiety related to what's going on with them. They don't know what's happening to them. So they get to see us, we diagnose them with the diabetes, we give them a plan of care. They may be able to correct it without any medication. Some patients might need that continuum of medication to get them stable, and there may be the anxiety or depression related to, now my life has changed, now I can't eat like the rest of my family is in the Black community or the minority community, the Hispanic community, with the rice or the heavy sauces or the fried foods. So that's a part of our culture that we lay heavy or lean into and take pride in, that's now gone, and having to learn how to cope with that. So that's where we love to refer to our mental health, behavioral health partners, and it's a beauty of what we have here at Edgewater that we're able to do that in-house.
I was going to say the same thing, April. I was going to say thank goodness for Edgewater, who treats the whole body, as far as the total body, from the mental side to the physical side. So let's talk a little bit about you and your history. What made you go into nursing? Where are you from? How did it all start? Who is April Donald?
Okay, so I was born in Gary. I graduated from Wirt High School many moons ago. Yes, Wirt Troopers. And I got into nursing watching my mother go. She was in the nursing field. My grandmother was, and it was kind of in my blood. I was running around the nursing homes when I was 8, passing ice, and it was always in my nature. And I think a lot of people, especially in our community, talking about Gary, it definitely is a community that has my heart. Many of us are not encouraged to go on for higher learning. So I did go to Ivy Tech at the time.
Great nursing programs.
And I was able to get a nursing certificate as an LPN, and I just kind of kept going. So I had great teachers to look at that time at Wirt High School who I looked up to, gave me pride in being who I was and being a brown girl. Gloria Griffith, I believe, is still kicking around.
Yes,
Shout
she
out
is.
to Gloria
Hey,
Griffith.
Miss Gloria.
We love you. Taught me how to write that 5-paragraph essay, and it brought me through the undergrad and the graduate level courses.
Oh, I'm sure she'd love to hear that.
Yes. And Mr. Lott was the first black man who I had ever seen wear dreads.
Mm-hmm.
And it just made such an impression on me as a young mixed girl to see that.
Mm-hmm.
And it definitely was a choice to come work back here. There's many opportunities, and I'd love to come back and work with our people here, with our black and brown people, and our other folk who lay a stake here in Gary.
So you have always practiced here? Have you not worked?
I have not.
Okay.
I have not always
So what
practiced
other
here.
places have you been?
I've been all over, really, Northwest Indiana.
Okay.
As a nurse, I worked in long-term care for a while. I did hospice, which was all over Northwest Indiana. So as far as I would be out in Whiting, I'd be in LaPorte, I'd be in Rensselaer. I
Okay.
did nursing education, and I'd be all the way out in Indianapolis, Lafayette, Munster, all over the place.
Very impressive career, April. Now, you said something about hospice, and that again caught my ear as far as we talk about how your career and your career path impacts mental health, but talk to me about what regimen or things do you do to stay mentally sound, because I know you see and have witnessed things in the medical field that could be tragic, that could be scary, that could be emotional, especially in hospice, because that's end of life care.
Yes,
and
it
so
is.
being strong for others is one thing, but how do we stay strong for April?
That's a great question. She didn't prepare me for this, I'll have you all know. I think that healthcare providers, most of us do a really bad job at taking care of ourselves, honestly. But what I've learned over time is to turn the rest of the world off and get into you outside of your profession.
Mm-hmm.
So I'm not just a nurse practitioner. Outside of that, I many years ago enjoyed working out in a group setting. These days I do it by myself. Most of the time I'm into my faith.
Okay.
So I'm reading, I'm praying, I'm studying. I do enjoy research, so I do a lot of researching as far as medicine is concerned on my own.
Wonderful.
It might seem like work, but it helps relax my mind
Okay.
to find the answer to things.
Yes, and we all have different ways that we unplug,
Yes.
and so that we can rejuvenate and get back in the game. So what would you say are some of the most rewarding moments and times when it comes to being a nurse?
Oh my goodness. By trade, I'm a geriatric nurse.
Okay. Oh, we
But-
love seniors.
Yes.
Oh.
By trade, I'm a geriatric nurse. But when I did hospice, I took pediatric patients. It was my first exposure. And when I did that, my nurses thought I was absolutely crazy. But because I did it, they did it with me. And it was one of the most rewarding things I ever did.
Awesome. So as we get ready to close out Mental Health Awareness Month, are there any other tips that you would say to those who are maybe watching
Yes.
and thinking about, I don't think I'm okay. I have problems telling somebody that I'm okay, and we've been talking about it all month about
Yes.
how to take that step to get the help that we need, because there's already a stigma in our community
It
that we don't
is.
talk about mental health. And so I just love to hear from our Edgewater professionals
Sure.
about their various tips around let's take that step to get that help.
One thing I do want to dispel is that mental health is a part of everyone. That everyone will have times in their life where they don't feel so well, where they're feeling mentally bogged down. You might have some rushing thoughts, and that's just part of the human experience. But if you're not able to bounce back, that's when you do need help. So the way to get help would be to call your primary care provider.
Okay.
If you don't have one, you can call us up. We'll be happy to see you.
And
And
hit
get
that
you
website.
connected.
Yes.
Our website at edgewaterhealth.org. And we will be happy to get you connected. You're not alone.
That's great advice. I have been chatting with nurse practitioner April Donald, who has been giving and giving and giving to our community and doing a great service. I always say nurses are angels walking on earth.
Oh.
Thank you for all that you are doing and will continue to do. And thank you for giving us your insight on mental wellness, this mental Health Awareness Month. I'm Chelsea Whittington. I've been your host today on behalf of Edgewater Health. Make sure you follow us on Facebook and get more information at edgewaterhealth.org. We'll see you next time.